because of the variety of my practice, it ends up being, first of all, looking at my emails, ensuring that I've looked after any administrative aspect. If it's a clinic day, obviously seeing the patients, making management plans. In between, responding to questions from my nurses and admin, even over lunch hour, just addressing those, calling some of the patients, fitting some extra patients in. So that's what a full day looks like.
So typically, I would go in and do my hospital rounds in the morning, and then go to my office and do an office day's work there. We basically always had third-year medical students, which meant that we changed our hospital duties a little bit, and we started having some hospital clinics as well. And our hospital days always included time with the students teaching. So that actually was, I thought it was a real bonus. It was real interesting.
Working with children is always interesting. You never know what they don't have a filters, but they're always interesting, and they ask you for your age. That's one thing very common. And a 10-year-old asked me for my age, and I said I was 21-year-old, and he said, "Oh my God, you're so old." Because to a 10-year-old, a 21-year-old was old, you know. So they always keep you, you know, it's, especially when you get older, it's nice to be with the younger population. They keep you young, you know. I enjoy it very much because it just keeps you young and on your toes.
I love that there isn't really a standard day. There's lots of, we do lots of clinics, there's lots of different change, but typically my day starts somewhere between 8 and 8:30. Every day starts with all of us, there's 8 of us, coming to the inpatient ward and seeing our babies in the nursery and our kids on pediatrics. And then we have a couple of days a week, we have teaching rounds for ourselves, our nursing staff, and our residents from 9 to 9:30. Twice a month, I drive up to Parry Sound and I do a clinic in Parry Sound. And so I often will have meetings at lunchtime. I don't move slowly very often, and so busy is really good for me.
And then the most frustrating thing that I find is finding services for certain patients, especially the patients with autism. Mental health problem is a major component, especially in a pediatrician who is working in a very diverse community. The community where I work, the visible minority make up about 50% of the population. The thing is about mental health is generally a taboo in most of those cultures. So they want you to manage those problems. We are lucky to have 4 child psychiatrists in our community with whom we really consult often.
If I do, which is often the case, have a learner, I would ensure that when a learner's seen a patient, at times go in and observe what the learner is doing in terms of their history taking and the assessment of that patient, and then have a discussion around their management and as to how they'd like to manage. And then ensure that if I have a learner, I spend probably half an hour, 45 minutes to an hour, spending time over what cases they saw, doing some teaching around those cases.
There are more than about 3 or 4 who left in the past 30 years. So all of them have been here, and so have been the new recruits like. So obviously, there's something positive happening. You know what I'm trying to say is for them to remain there. And so I think most of it is we help each other.
I was a little bit worried that working out in a smaller community was going to be somewhat repetitive and tedious. And within a week of starting practice, I was completely astounded at the variety and the complexity and the interesting aspects of the patients and the kids and the families that I was seeing. And that never went away. It remained very varied, interesting, and always challenging in a good way.